Welcome to Module 8. Module 8 is all about gynecology, the study of women, and obstetrics, which relates to being pregnant and 6 weeks after birth, or thereabouts. Gynecology, we can break this down. Gyn, or gyneco, means women. Ology, study of, so therefore gynecology is the study of women. Let's look at some words and root terms. Here we have a diagram of the female reproductive organs. Let's have a look at it. You can see on the diagram the ovaries. And the ovaries produce the eggs, and the eggs will pass through the fallopian tube into the uterus. And if they're lucky, they might get fertilised, and then they would embed themselves within the uterus wall and turn into a beautiful baby. Let's look at some root words. Colp is the term for vagina. Cervix is the neck of your womb. You have to remember we've had the word cervix before relating to your neck up here, so do put it in context. Hyster is the medical root term for your womb, your uterus. And there is another one as well. Metri or metra means uterus. The lining of the uterus is known as the endometrium. And when ladies have their periods, this is the bit that breaks away and comes loose. And it is refreshed each month, waiting for a nice little egg to come along and get fertilised and embed itself. We can break the word down, endometrium. Endo means inside, metri is uterus, so it's inside the uterus, referring to the lining of the uterus, the endometrium. Men relates to the word menses, and menses is the term relating to your period. So when you have a period, the endometrial lining comes away and is expelled via the vagina. Salping, lovely word, means fallopian tubes. Oofers are your ovaries, and mast or mam relates to breasts. Let's look at some words with these root terms. Firstly, colp. A lady may go for a colposcopy. That would be a visual examination of the vagina, oscopy being our visual examination with a lighted instrument. A lady may also go for a cervical smear. This is when some cells are taken from the neck of the womb, making sure there's no abnormal changes. Hyster. A lady may have a hysterectomy, removal of the womb. Endometrial. AL at the end of a word means relating to. Endo is inside, metri is the uterus, so therefore endometrial means relating to the lining of the womb, relating to the endometrium. And a fairly common condition is something called endometriosis. We can break this down. Osis is our disorder or condition. Endo is inside, so it relates to a disorder of the inside of the uterus, i.e. a disorder of the endometrium. Now, bizarrely, endometrial tissue can actually grow outside of the uterus. So it can be found on the ovaries, on the fallopian tubes, on the ligaments holding everything together. And it can, in some people, in quite rare cases, grow in the most bizarre places, maybe on the liver. And it can be a very painful event for people who have extreme endometriosis. Dysmenorrhea. Urea is our discharge or flow. Dys is difficult, so it's a difficult flow of menses, which means a difficult or painful period. Our next term, hysterosalpingogram. We can break this down. Gram is tracing, salpingo we know is fallopian tubes, and hyster is uterus. So we have here a tracing of the fallopian tubes and uterus. And this may be done when they're trying to find out whether there is a blockage and the egg cannot get from the ovary to the uterus. So the fallopian tube is not allowing the egg to pass through. And they would therefore perform a hysterosalpingogram, squirt through some dye. Oophorectomy. Ectomy, removal of, so it's removal of an ovary. Mammography. Graphy is X-ray, so mammography is an X-ray of the breast, commonly done in order to rule out cancer if there's a breast lump. Another term with breast in it would be gynecomastia. This isn't common, but it's an interesting word. IA at the end of the word means a condition. Mast is breast and gyne is women. So it's a condition of having breasts, and this is in relation to men who may start growing breasts. Terms used in pregnancy. First of all, the term gestation. Gestation is the time from the last menstrual period, known as LMP, to birth. And in humans, the gestation period is considered normal from 37 weeks to 42 weeks. But we take the average, which is about 40 weeks. The period of pregnancy is divided into things called trimesters. And the first trimester is the period from the last menstrual period to the 13th week. And in this time, the uterus will grow and there may be a small little bulge on the lady's tummy showing that she's pregnant. The second trimester is the next 3 months really. It's from the 14th week to the 27th week. And during this period, many people have ultrasounds to assess the age of the unborn baby or the health of the unborn baby. And I have an example here. Here is a picture of my son in my tummy, and you can see a hand holding the umbilical cord which connects mum to baby. That was taken at 16 weeks. The third trimester is 28 weeks to 42 weeks. I have another ultrasound taken at 29 weeks, and I think this is amazing. You can see my boy's face so clearly. I called him my little angel. The term FH stands for fundal height, and this is the measurement taken from the pubic bone to the top of the uterus. This would be from approximately down here to the top of the tummy. So at 28 weeks, they'd measure from the pubic bone up to approximately there, which where the top of the uterus would be. Conveniently, the uterus grows approximately 1 centimetre per week. So if you had an FH of 32 over 40, the 32 relates to the 32 weeks pregnancy, which actually would be about 32 centimetres in length over the 40 weeks. Gravida is the term for pregnancy. A person having their first pregnancy would be termed as prima gravida. The abbreviated form would be G1 for gravida 1. If you are on your fifth pregnancy, it would be described as G5, gravida 5. Or if you've had more than one pregnancy, the general term is multigravida. Primipara, or P1, relates to the first pregnancy to birth. Multipara, as for example P5, would imply that you've given birth to 5 children. And if you saw the abbreviation G3P2, that would refer to gravida 3, so you've had 3 pregnancies, para 2, but only 2 to birth. Terms associated with pregnancy and birth continued. Ultrasound scans. Well, I showed you a couple of my son, and these are routine scans done to determine the age of an unborn baby and also to check for any abnormalities. Ectopic is a term that means out of place. It's not normal, and some women may have what's called an ectopic pregnancy, and when an egg becomes fertilised, it should embed itself in the uterus, in the endometrial lining. For some people, however, the egg may embed itself in the fallopian tube, and this would be called a tubal ectopic. So it's a fallopian tube pregnancy, and this can be very dangerous. One of the routine tests done during pregnancy is to check for rubella status. Rubella relates to German measles, and a rubella status check is seeing whether a pregnant mother has actually had German measles or has immunity to German measles. So have they had the MMR when they were younger, the measles, mumps, rubella vaccine? If not, then the mother is not immune to German measles and would be recommended to stay away from anyone with German measles. An unborn child whose mother contracts German measles is at risk of developing some serious abnormalities. Proteinuria. Another test done during pregnancy is to see if you have protein in your urine. The reason this is done is to check to make sure a patient is not going to be developing preeclampsia. And preeclampsia is a dangerous condition in pregnancy where you get really high blood pressure, so you have hypertension. If you have hypertension and proteinuria, the likelihood is the pregnant mum would be staying in hospital so they can have regular checks on themselves and the baby. FHH would be fetal heart heard. You may have the term FHHR as well, which means fetal heart heard and regular, so everything's fine. Partum or parturition relates to the act of giving birth. Some people have what's called an antepartum hemorrhage, or an APH is the abbreviation. Anti is before, partum is the labour, and hemorrhage is bursting out of blood. So it's a heavy bleed before you've given birth. You are considered to have had an antepartum hemorrhage if you are bleeding from approximately 24 weeks. Postpartum hemorrhage would be a bleed, the hemorrhage, after labour. So you've given birth, but then you have a heavy bleed. This is called a PPH. And to be classified as having a PPH, you have to lose approximately a pint of blood. Natal means relating to birth. So neonatal would be a newborn. Antenatal would be before birth. So many women go to antenatal clinics, the clinics before baby is born. And postnatal, after birth. Some women may get what's called postnatal depression. After birth they can become quite low and quite depressed. But let's go back and look at one of the investigations that can be done, amniocentesis. Amniocentesis is a procedure that many women have to assess the health of their baby. It is a medical procedure used in prenatal diagnosis, that means before birth, for genetic abnormalities of the fetus, the unborn child. A small amount of amniotic fluid is drawn up from the amniotic sac, which surrounds the developing baby, the fetus. This fluid that is drawn up will contain something called DNA, which is our genetic material, and this can be analysed to find out if there are any genetic abnormalities, such as Down syndrome. Let's have a look at the terms. Amnio means amniotic fluid, and centesis means to draw off fluid, so consequently amniocentesis is to draw off amniotic fluid. I had an amniocentesis and it was quite amazing watching the screen. I didn't really want to watch the big needle coming in, and I watched the ultrasound screen, so the little television screen to my right, and the doctor with the ultrasound probe was feeling my tummy, checking out where my baby was, and then when he was ready, put the needle in and withdrew fluid. Now, I didn't actually feel the needle go in or anything, it was fine, but what I did see on the screen was the needle going in, and as it went in, my little boy inside my uterus literally went, whoa, and jumped back. It was quite amazing to watch, and everything was fine. Let's look at some abbreviations. LMP was the last menstrual period. EMU means an early morning urine, commonly done for pregnancy tests. G3P2 relates to gravida 3, so 3 pregnancies, and para 2, so 2 pregnancies to birth. When you have a child, the doctors perform something called an APGAR score. An APGAR relates to the appearance, pulse, grimace, activity and respiration of a child. It's a simple method to assess the health of a newborn child. Depending on the APGAR score will depend on whether your baby needs to go to intensive care or not. And on that note, I have a picture for you. Earlier I showed you the ultrasounds of my son. He was born early, he was premature, and here he is in the intensive care unit, in his incubator. He was born at 30 weeks and was considered small for dates. And here is a picture of him when he's 2 days old, and to see the size of him is quite unbelievable. And here we go. Look how small his little hands are compared to my finger. I hope you can see that. FH, remember we had fundal height, so 20/40 would relate to 20 weeks. It can also mean fetal heart or family history. APH was the antepartum hemorrhage when you bleed before birth. PPH, postpartum hemorrhage, when you have a bleed after you've given birth. ERPC is the term meaning evacuation of retained products of conception. Now, people may have an ERPC because they're having a termination of pregnancy or because they need to have tissue removed from a miscarriage. VE is a vaginal examination, and TOP refers to a termination of pregnancy, and STOP refers to a suction termination of pregnancy. There are different ways of terminating a pregnancy, whether it be through an operation, a simple operation, or through medical means. It's time for In Your Head, and this is a real mixed up head one, this one. So let's have a look at the terms on the right hand side. Primipara, ectopic, gravida, neonatal, hemoptysis, hemometra, salpingo. Have a think about them and see where you think they match up on the right hand side, and in a minute I'll click my magic button and they will slide into place. Primipara was the first pregnancy to birth. Ectopic means out of place, so you could have an ectopic pregnancy, one in the fallopian tubes. You can also have an ectopic heartbeat, which means an extra heartbeat. It's not supposed to be there, an extra sound. Gravida means pregnancy. So primigravida would have been first pregnancy, or you see an abbreviated form G1 or G2 for the number of pregnancies. Neonatal, new birth, newborn, neo is new. And then the next one is hemoptysis, coughing up blood. Hemometra is actually blood in the uterus, so it would be a build-up of blood in the uterus. And salpingo, lovely word, fallopian tube. Time to look at some suffixes. Our first one is emesis. Emesis means vomit. So if a patient has hyperemesis, they will have excess vomiting. In pregnancy, for example, many women get morning sickness when they feel sick and may actually vomit, though it can actually occur any time during the day, but some will have excess vomiting, hyperemesis, and really can't hold anything down. There are other reasons for having excess vomiting too. Centesis means to draw off fluid, so amniocentesis was drawing off the amniotic fluid to test for DNA abnormalities, genetic abnormalities in the baby. Pleuracentesis, not a gynae word. So pleura related to the pleural membranes, the membranes surrounding the lungs. So pleuracentesis was drawing off fluid from the pleural membranes. Seal, spelled with an O or not, means swelling or protrusion. Proctocele would be a swelling or protrusion of the rectum into the vagina. Or another term meaning exactly the same thing would be rectocele, rect referring to rectum. So what can happen after childbirth? A lady's vaginal wall may be very weak, and so the rectum can bulge through that weakness, a type of hernia, when something bulges into something else. Orage, bursting out. Menorrhagia, bursting out of menses. Sounds horrible. Better way of saying it, heavy period, but very heavy periods. Another term, hemorrhage. Well, that would be bursting out of blood, otherwise known as a heavy bleed. If someone's hemorrhaging, they're losing a lot of blood. Osis means condition or disorder. So endometriosis is our disorder of the inside of the uterus, or a condition of the lining of the uterus, the endometrium. Next, we're going to look at some terms associated with fibroids. Uterine fibroids, more commonly known as fibroids, have many names, including fibromyoma or uterine leiomyomas. These are benign lumps, tumours, that originate from the muscle layer of the uterus. Fibroids vary in size and position within the uterus. And here we have a diagram showing some fibroids. In the bottom right-hand corner, there's one on a stalk. If something is on a stalk, it is termed pedunculated. So there you would have a pedunculated fibroid. Fibroids vary in size from microscopic lesions, really, really small ones, to lesions the size of grapefruits or bigger. And these can obviously be felt by the patient if they're that big, through the abdominal wall. Most fibroids are asymptomatic, meaning they have no symptoms and are therefore not an issue to the patient. But treatment is offered when symptoms do occur. Let's look at the root terms associated with fibroids. Well, fibro means fibre, but the fibrous tissue it is talking about relates to muscle tissue, ligaments, cartilage, a whole variety of fibrous tissues. Oid means like or similar, so hence fibroids means they are fibre-like. Myo is muscle. Li or leo is smooth, relating to smooth muscle tissue. Micro is small, hence microscopic means it's visually small. Oma is our tumour, our swelling, our mass, our lump. Let's look at some words. Benign means harmless, it's not cancerous, so fibroids are benign, they're harmless, as in not life-threatening. A tumour is a mass or a lump or a lesion, and the term lesion is any tissue change from a spot on your face to a tumour. In this list of terms we have root terms, suffixes, and even a prefix, micro being the prefix, and some complete words, benign, tumour, lesion. Let's look at this in a new light. Here we have the same verse, uterine fibroids, fibromyoma or uterine leiomyomas are benign tumours. When you come across medical text Remember not to be afraid of it and use your knowledge of breaking down words. So uterine fibroids. We can look at that word and think, fibroid, yes, I know what a fibroid is. I can break it down. Oid means like, fibre is fibre, and therefore it means fibre-like. That's what fibroids are, they are fibre-like. Fibromyoma, the next word, we can break that down. Fibromyoma. So you know that oma is the tumour or the swelling, and my is muscle, fibro, fibre. So it's a fibrous muscle tumour or lump, another term for a fibroid. Leiomyoma, well, this is a new one, so even if you didn't know what the leo bit means, you can still break it down and think, oh yes, oma is tumour, my is muscle. We know leo means smooth, so what we have here is a smooth muscle tumour. Smooth muscle is a type of muscle which you find in the uterus. Benign tumours, well, that's nice and easy to break down. Benign we know means harmless, and tumours relate to lumps and bumps, or mass or swelling. Microscopic lesion, well, a lesion is just a general broad term meaning a change in a tissue. It's microscopic, so it's visually small. The scopic is the visually bit, and micro, small. Asymptomatic, nice, easy, let's break it down. A at the front of a word means no, ic at the end means relating to, so it's relating to no symptoms or just no symptoms. So reading medical text, remember you have the knowledge to break down big complicated words, and it will help your understanding of medical text. General terms. Our first term, polyp. Polyp, you may remember, is a protruding growth, and we talked about polyps in the intestine, so one's in the colon, and you can have polyps in your nose, you have nasal polyps, and you could have polyps in your cervix, the neck of the womb. You may hear the term dysplasia of a polyp. Dysplasia meaning disordered formation. So dodgy polyp. Ablation relates to the destruction or removal of tissue. So if you have endometrial ablation, they are literally removing the endometrial lining. A prolapse is when something has fallen out of place. For example, you could have a prolapsed intervertebral disc, a slipped disc or a bulging disc when you're talking about your spine. But you could also have a uterine prolapse when literally the uterus has fallen out of place. A biopsy is when you actually remove some tissue for examination. And biopsy is obviously used in many areas of medicine, but in relation to gynecology, if a lady needs tissues removed from her cervix, the neck of the womb, it may be called a cone biopsy, basically indicating the shape of the tissue that is actually removed. Aspiration means to draw off fluid, suction through a needle. Or it can mean inhaling fluid or food into the lungs. Let's look at a couple of examples. A common example is something called a fine needle aspiration or a fine needle aspiration biopsy. And this could be done of the breast. For example, if a lady has a lump on her breast, and the abbreviated form would be a FNAB. An example where you're inhaling food would be pulmonary aspiration. Catheter is the tube that is used to drain off fluid or to add fluid. A urinary catheter would drain the urine from the bladder. We're going to look at some words here for you to think about. Let's look at the first one, laparoscopic hysteroscopy. Hysterosalpingography. Tuboplasty. Menorrhagia. Endometrial ablation. Dilation and curettage. Fibromyoma, fibroids, and microscopic lesions. Let's have a think about these and see what they may mean. So first of all, laparoscopic hysteroscopy. Well, laparoscopic breaks down to be visual examination through the abdomen, keyhole surgery, and hysteroscopy is the term visual examination of the uterus. So therefore it's visual examination via the abdomen, i.e. keyhole surgery, to visually examine the uterus. Our next term, hysterosalpingography, or hystero, break, salpingo, break, graphy. Graphy is our X-ray, so it's an X-ray of the fallopian tubes and the uterus. Tuboplasty. Tubo, break, plasty. Plasty, surgical repair, and the tubes relates to the fallopian tubes. Menorrhagia. Orrhagia was bursting out of blood. Men is menses, so it's bursting out of menses, otherwise known as a heavy period. Endometrial ablation. Well, ablation, a moment ago we were told, relates to the destruction of tissue, removing tissue. So it is removing the lining of the uterus, usually by laser or possibly by hot saline. There's various methods. Dilation and curettage. Some of you may have heard of this. So curettage is actually the posh word for a spoon-like instrument. So dilation and curettage is literally dilating the cervix, the neck of the womb, and using a curettage to scrape out the uterine cavity, a DNC. Sometimes it's called a scrape. Fibromyoma, we can break this down. Fibro, break, break, oma. Oma is our tumour, our lumps. My relates to muscle, and fibre is the fibrous tissue. What we have here is a tumour or a mass of muscle and fibrous tissue. And lastly, microscopic lesions. Well, lesions are tissue that has shown any pathological change, any change from the norm. And microscopic means visually small. So basically we're saying lesions that are small. And next we have in your head. It's time for a bit of mix and match in your head. So let's get cracking. On the left-hand side we have endometriosis, menorrhagia, mammography, biopsy, colposcopy, hyperemesis, oophorectomy and fibromyoma. Give you a moment to think about those and see what you think they mean. Endometriosis, disorder of the lining of the uterus. Menorrhagia, orrhagia is our bursting out of menses, otherwise known as a heavy period. Mammography, graphy is the X-ray, mam, breasts. A biopsy relates to removing tissue for examination. A colposcopy, oscopy is our visual examination with a lighted instrument to examine the colp, the vagina. Hyperemesis, emesis is vomiting. Hyper, excess vomiting. Oophorectomy, removal of the ovaries. Oofers are ovaries. And fibroid, or fibroids, are fibromyoma, one and the same thing. A very common screening process that ladies have is something called cervical screening, more commonly known as a smear test. Let's have a look at this in more detail. First of all, when a lady is having a smear, they are actually looking at the cells at the neck of the uterus, the cervix, so right at the top, and there's a zone which is called the transformation zone, or the T-zone sometimes it's known as. And this is the area where the nurse or the doctor will try and get a good sample of cells to be examined. Cells from the epithelial tissue, which is the name of the tissue lining the cervix, the neck of the womb, are removed using a brush and examined in the cytology labs. Cytology literally means the study of cells. Any abnormalities or changes are observed and reported upon, and what they're looking at is actually what's called the control centre of the cell, the nucleus, and this can change, and there are different levels of changes. If changes have occurred in the cells, they are described using a grading system, and this is known as CIN, which stands for cervical intraepithelial neoplasia. We can break this down. Cervical means relating to the neck, as in the neck of the womb. Intraepithelial, the AL relates to relating to. The epithelial part is the epithelial tissue, or the epithelium, and intra means within. So within the epithelial tissue or cells, they're looking for neoplasia, new formation or new growth. So changes is a simple way to describe it. So let's just recap that. Cervical relating to the cervix, intraepithelial within the epithelium, and neoplasia, new formation. Simply put, new formation or changes to cells within the epithelium of the cervix. Let's look at the words and the terms used for the different levels of changes. CIN1 refers to mild changes, and if a lady has the result of a CIN1, the doctor may say, come back in a few months' time to have a repeat smear. A lot of the time, these mild changes revert back to normal and there's nothing to worry about. The term dyskaryosis is a word used to describe what is actually happening within that cell. Dys means difficult or disordered. Kary actually means nut, relating to the nucleus of the cell, the control centre of the cell, and osis is our disorder or condition. So therefore we have a condition of a disordered nut, a disordered nucleus. But it's mild in CIN1. That's how you break down the word, dyskaryosis. CIN2 relates to moderate changes. So moderate changes to the nucleus of the cells. CIN3 is severe changes. With CIN2 and CIN3, the patient will be investigated further, and a cone biopsy, we mentioned earlier, may be done in order to get a really good sample of the tissue at the top of the cervix. Let's remind ourselves of some abbreviations and add some new ones. Some gynecological abbreviations. The first one, PID, relates to pelvic inflammatory disease, and pelvic inflammatory disease is a very vague term really, implying inflammation and perhaps adhesions, which is scar tissue, around the female reproductive organs. And there are many reasons why a lady may have PID, pelvic inflammatory disease. But we also have to remember to put this abbreviation in context. PID referred to a slipped disc, but normally in that case it would have numbers after it. For example, PID C6, C7, a slipped disc between the 6th and 7th cervical vertebrae. Next term, HVS, is a high vaginal swab. HSG is hysterosalpingogram. We can break that down. Gram is our tracing, salpingo is the tubes, and hysto is the uterus. So it's a tracing of the fallopian tubes and the uterus. A DNC, we mentioned this earlier, is dilation and curettage, otherwise commonly known as a scrape when the endometrial lining is removed with an instrument called a curette. It's like a spoon. CIN relates to cervical intraepithelial neoplasia. That's new formation within the cells of the cervix. If there are significant changes to the cells of the cervix, so normally graded as CIN2 or CIN3, then an LLETZ or a LETZ may be performed. And this is a large loop excision of the transformation zone, where tissue from the cervix is removed in order to remove these abnormal cells. Apparently it is quite a quick and simple procedure. TAH, total abdominal hysterectomy, that would be removing the uterus. PV means per vagina, meaning through the vagina. You can also have the term PR for per rectum, so through the rectum. BSO, bilateral salpingo-oophorectomy, ectomy, removal of. Oofers are your ovaries, salpingo, fallopian tubes, and bilateral both sides, removing the tubes and ovaries on both sides. And next it's time to break down some words. Let's break it down. Our first two terms, proctocele and rectocele. Proctocele or rectocele both break down to mean exactly the same thing, which is protrusion of the rectum into the vagina. It's a type of hernia, something protruding into something else. Cystocele or cystocele, let's break it down. That'd be a protrusion of the bladder into the vagina. Our next term, amenorrhea. Let's break it down. A, break, men, break, orrhea. Orrhea means flow or discharge. Men is menses and A is no. So we have no flow of menses, no periods. Dysmenorrhea. Dys, break, men, break, orrhea. Here we would have difficult flow of menses, painful periods. A bilateral oophorectomy. Bilateral means both sides, and oophorectomy, removal of the ovaries. Endometriosis. Let's break it down. Endo, break, metri, break, osis. Osis is our condition or disorder, so I have a disorder of the lining of the uterus. The lining being the endometrium. Some more terms to break down. Salpingitis. Let's put the break in. Itis means inflammation, and salping, that's our fallopian tubes. Inflammation of the fallopian tubes. Prima gravida. Let's break it down. Primi, let's break, gravida. Gravida means pregnancy, and primi is first, so it'll be the first pregnancy. Also abbreviated as G1. Mammography, break it down. Graphy is our x-ray, mam is breast, so it's an x-ray of the breast. Mastectomy. Ectomy is removal of, mast is breast, so removal of the breast. Neoplasia, let's break it down. Plasia means formation or growth, so neoplasia was new growth, new formation, and usually associated with cancer. Our next term, endocervical polyps. Let's break it down. Endo means inside, cervic is the cervix or neck, and AL relating to. So we have polyps, which are the growths that came from the mucous membrane. So I'd have a polyp on the inside of the cervix. Another term would be cervical polyps. Hypoplasia of the cervix. Let's break this one down. Hypo, break, plasia of the cervix. The cervix is the neck. Plasia is our formation or growth. And hypo means reduced or insufficient. So hypoplasia is saying that we have an insufficient formation of the cervix. It is not formed properly. And this is a problem that would occur from birth. It is a congenital problem. Insufficient formation of the cervix. Now we're near the end of this module and it's time for a last in your head. In your head, female organs. Let's have a look. What I want you to do is to think about where the labels would go. So endometrium. Which part of this diagram relates to the endometrium, the inside of the uterus? There we go. The term endometriosis related to the disorder of the lining of the womb, where the endometrial tissue grows outside of the uterus, commonly on the ovaries and the fallopian tubes. Our next term, myometrium. That relates to the muscle layer of the uterus. Myo is muscle. Oofers are your ovaries. Salpingo, fallopian tubes. Colp is the vagina. Cervix, the neck of the womb, and the transformation zone is the area where they try and collect the cells when doing a cervical smear. This is the last slide before your quizzes, and I thought a recap on some abbreviations might be useful. Do just look through them, and if there's anything you really can't remember, go back to the module and look it up. It's quiz time! This is the end of Module 8, Obstetrics and Gynecology. This is the end of the Module 8 video. Please try the short exercises to reinforce your learning, and you will find those below. Enjoy!